Hello, everyone. It is Sunday. Once again, we're coming at you on a beautiful day here in Texas, and I'm assuming it's beautiful out there in California since I see Mike smiling real hard. And the bottom line is, ladies and gentlemen, we have a special guest, hormone specialist, Dr. Leslie, who's going to sit down and explain everything to us. So if you got your pens and paper, and if you don't have it, you might want to go grab it while Mike introduces everything, and we can kind of go from there and move forward. But we'd like to welcome you, Leslie, and hello, my friend Mike. How you doing, brother?
Hey man, everything's great, man. On my end, man. It's not hot today. It was a nice sunny day, man, and Northern Cali, man. And I appreciated the weather, man. You know me, man. Every time God allows us to put our feet on the ground and I can get outside a little bit, I will do that. But yeah, I'm excited, man. I'm excited as well, man. Our special guest, man. You know, we always talk about, with some of these topics that she's going to be talking about today, but we always put that disclaimer. Yeah. We are not doctors. we two old guys that that got some experience, but we not doctors. But we brought you a doctor today.
There we go.
We brought you a doctor today, and just want to let you know that I call her a friend of mine. I call her a workout partner every now and then. You know what I'm saying? Every now and then I get out there to where she's at, and I call it God's country because it's beautiful when we out there working out. But she's a hormone specialist, man. She's Stanford. She got Stanford background, man. So so she's not one of those BS people, one of those BS doctors. She's got some background behind her. She's got a lot of experience behind her, and also a sports background. So she can tie in a lot of stuff. So hopefully, if you got questions out there, ask them. I want to introduce my friend, my doctor, not my doctor, but she's a doctor, Dr. Leslie Brocchini. How you doing, Leslie?
I'm good. How are you guys? Thank you for having me. I'm so happy to be here.
Absolutely.
Good. Before we start, man, asking you questions and everything, I always ask, your IG handle is Soul Strength Medicine. Now, how did you come up with that before we get into anything about you?
Yeah, I mean, I went through a lot of years training in medicine, and we all go through challenges in life. And there was a time where I kind of felt like I had some young preteen kids, and I was practicing medicine, but it wasn't fulfilling me, and I didn't think it was fulfilling my patients. And I felt honestly like it was soulless, if you will. I didn't have time. I had 10 or 15 minutes to hand out prescriptions, and I would say there's stories that people tell you. And I had a patient one time that I was struggling with her weight, and I had been seeing her for a couple of years and prescribing medications. And at one visit, she said, "I'm never going to lose the weight." And I said, "Why?" And she said, "Because every night at 10 o'clock when my dad used to abuse me is when I eat a pint of ice cream, and that's probably never going to stop." So at that point, I realized there's just the elephant in the room. Like, I had never had time to talk to her about like the real, like the deep stuff, right? The soul stuff. Like, her soul was not well. And so I had thought I was practicing, evidence-based, the best medicine, but I wasn't practicing soul medicine. So and then struggles in my life as well. I realized that there are times where I was doing everything right physically, hormonally, but my soul wasn't right. And so decisions I was making were not the best for me. So I just think you have to be strong in your soul. And I think that we always have to get to the root cause and find kind of the basics, and then we can build upon that. But if we don't have strength in our soul, we're not going to get very far.
Excellent. Got it. I thought it was like James Brown stuff, which, you got soul. But...
Well, we can do that too. I like that too. I'm good with that. But I think we have to have a balance of everything, and the mind body part of it, I think, is critical. And I think that's a lot of, I didn't learn that in medical school. I learned that in my integrative medicine fellowship, but that was after medical school.
Awesome.
Well, let's jump right into it, because I have shared with people that I know about, we're going to be talking about peptides and things like that. So I know that there's people online right now listening to all of that. And I actually have a client, and her and her husband actually owns a health clinic, and including peptides and all the other things that come along with it. And I've learned some things, and I'm always willing to be open to hear some other things too. And if you could just share with us, why is it when you're on a peptide that you have a tendency to lose muscle? Is it because of lack of protein and not working out while you're on the product? Or is that kind of part of it because it's actually another foreign medication that goes into your body?
So you're talking about GLP-1 peptides or weight loss
Yeah,
peptides
yeah,
specifically.
yes.
I think that, there's lots of peptides, but that one, of course, is popular and is all over the place. I think I think if they're super beneficial. As a longtime internal medicine doctor, for years I didn't really have the best tools to treat diabetes and metabolic dysfunction, obesity, fatty liver. These medicines are game changers, but they are powerful. And so there's several things they do on the body. One of the things they do is they make you feel full and they slow down food transition through your gut. And so people tend to not eat as much. And so you really have to push yourself to eat the protein, get the amino acids, or you could be, doing your resistance training, but if you don't have the building blocks, then you're not going to build muscle. So the risk of these medicines is that you could lose muscle and you could lose bone. And obviously, as we get older, over 50, we're at risk of doing that anyway. And so we have to be really careful. So you have to really, make sure you're getting your protein mark, even though your appetite's shut down.
Yeah. So when your appetite is shut down, and like you said, it slows down the deposit of the foods and stuff like that. So being regular and going to the restrooms and stuff like that, should a person take something to enhance that movement, or we just kind of let your body move forward? How did that work?
No, you definitely want to make sure. So I always tell patients you want to have 1 to 2 soft serve bowel movements every day, no matter whether you're on the medicine or not. I think that that's part of our looking at the whole picture. That's part of detoxing, right? So we don't want inflammation is kind of the bottom line. We really don't want inflammation in our body. If we have inflammation, then we're in a fat storing mode, not a fat burning mode. So our goal is always to try to be in a fat burning mode and a muscle building mode. And if we're inflamed and we're toxic because we're not having bowel movements every day, then that's going to impede that. So I tell people it's like taking out the kitchen garbage. Like you don't just leave your garbage in the kitchen for a week, right? You got to take it out every day. You got to keep things moving through. You have to be more aggressive with that when you're on GLP-1 peptides because it is slowing motility. So sometimes I have patients use specific forms of magnesium. I have sometimes people using Miralax. I always want people to optimize their fiber. I want them to have 10 grams of fiber with every meal. I like squatty potties. You have to have all the things, that's part of your whole body function. So if there's anything you're doing to optimize your health, but you're slowing down a bodily function, that's a problem.
Got it.
I got a question. So I'm coming in for the first time to visit you, Doc, and I'm a little overweight and everything, and I want to get on the GLP. What kind of program? This is like a sample program. Would you put me on? Because I know it's people out there that just say, hey, they give you GLPs and wave you by. They don't do anything, no follow-ups or anything. What kind of program would you be putting me on?
So, with my patients, I do a full kind of metabolic assessment. So, I usually have them do labs before they come in. So, the things I like to do are checking for inflammation. I like to check for glucose intolerance. I like to know if you're insulin resistant. I like to know if you have fatty liver. So, I check labs before you even come to just see how your body's functioning. I'm a functional medicine doctor, so I like to know how your body's functioning. I didn't mention in the beginning, my bachelor's degree is in biochemistry. So, I'm all about pathways. So I measure a lot of things and get a sense of what your body is doing. I also do a lot of talk about what your lifestyle looks like. Are you sleeping? I actually even ask questions about childhood adverse events because I want to know the entire person that's sitting in front of me and what are the obstacles we're up against and what things are influencing how their body's functioning before I start throwing any medication at them, including GLP-1s. So I measure a bunch of labs. I come in, I spend about 45 minutes to an hour with you. I measure your body composition. I measure your waist circumference. I want to know, are you carrying most of your fat in your belly? And that raises your risk for other things that I might look for. I might send you for coronary calcium score to try to assess if you have any heart disease. Most of my patients are over 50. I do have some younger ones. If I'm strictly doing obesity medicine, then it would be a little less complicated than that. But I also want to know like what your family history is. Like, does everyone in your family struggle with obesity? Because there's genetic components, there's lifestyle. So I need to figure out, is this your lifestyle? Did you do this because your lifestyle, because you have four businesses and you're eating McDonald's multiple times a day? Or are you doing all the things you possibly can and genetically your family just struggles with the disease of obesity? In which case, I would move a lot sooner to the GLP-1 because I think they're made for that. And then those people,
So,
I'm checking on what they're eating, what their protein intake is, and they're on the phone with me or my nurse every 4 to 6 weeks, and they're measuring body composition. And if I'm not getting that, or if I see people losing bone and losing muscle, then I take them off the med.
Awesome.
wow.
Awesome.
So with peptides, how many? Well, I guess you can't tell me how many, but I'm going to ask the question anyways. Over the amount of peptides that are out there, how many have actually been FDA approved?
Well, I mean, I think the ones that are FDA approved are the GLP ones. So the
Okay.
semaglutide, the tirzepatide, there's a lot on there that are on the FDA ban list. I think that's probably going to change. The BPC 157, the growth hormone, the insulin growth factor stimulants like Semorolin or Tesmorolin or, CPC. Those ones, some of those I don't really know. I think it's kind of a moving target with the current administration, but some of them are moving off the FDA ban list. Some of them are still
Okay.
on there.
Okay. Because I know a lot of people, including myself. Yes, I'm talking about me out there, people. But the Tesamorlin and the BPC 157, I'm utilizing that, and I was just curious on the effects of that because they said it's for diabetics, people who have inflammation. I mean, AIDS patients, people who got inflammation in their intestine area, and also carrying body fat within an area. That testosterone is supposed to be one of the main effects that will help that. Is that fact or is that just myth?
I think that that's based on very small, non-randomized controlled data, mostly animal studies. So I think that that's still a very gray zone. I think it's when you go in some of these areas in the gym and online, it looks like it's just fact, but it really isn't. The data is really not there. So I'm a biochemist, so I love peptides. I love amino acids. I think it's just a string of amino acids. So I don't think they should be on any sort of ban list, but I do worry a little bit about the gray market and where they're coming from. There's been a lot of compounding pharmacies across the country, and beauty clinics and chiropractic offices, places where things aren't being monitored, that have made the news where there's been contaminants. I haven't really
Uh-huh.
personally seen anything that's like super scary, but I think that it's a risk, and I don't have any judgment on that. I think people have the right to optimize their body however they want to. My goal when a patient comes to me as a medical doctor is to try to follow evidence-based medicine.
Right.
Good, good.
Mike?
I got a question, and it's kind of maybe a little bit off of that, but people always talk about women in menopause, but do men have like premenopause type things or something like that going on with them, hormone wise, as they get older?
Yeah, I mean, I think recently people have talked a lot about perimenopause and menopause. I think historically men's hormones have gotten way more attention, but I think both people have things to look out for. I would say both sexes really start to lose muscle after 50. Both people start to lose bone, cognition. Hormone start dropping. Melatonin's a hormone. People start sleeping not as well. So I think there's definitely more inflammation and hormone decline in both sexes. And it's not just testosterone. I think for men, I think the talk is always about testosterone, but really, I look at cortisol, stress. Men carry a huge load a lot of times in the families. They're providing. There's stress that I think is a little more silent, which I think I have a lot of. I spent 8 years working for the VA, so I had a lot of post veterans that I was working with. So there's a lot of cortisol issues and inflammation issues too that I don't think tend to come up as much as the testosterone conversation does.
Interesting. So You said 50 and older, you start losing muscle, you start losing bone. I can agree to that, but sometimes I can disagree to that. Meaning that if you've been working out for a long time, as myself, I don't think I've lost that muscle, but I think I've lost the hardness that was natural, if that makes sense. Like, is that part of a unbalance, hormone unbalance? Meaning that the strength and all that kind of stuff to decline, but you still have your shape that you've always had.
Yeah, so I think there's a difference between someone who has, when I say we start to lose bone and muscle, I mean if we don't do anything about it, like just
Oh,
in the
okay,
natural aging process, we start to
got
lose
it.
bone and muscle. Ideally, we are not doing that. We are doing our strength training, getting our protein, maybe using peptides,
Yeah,
keeping our hormones balanced to so that we don't. And I would say that we do. It's more difficult over 50 to build muscle for sure because we're kind of going against what's naturally happening. For sure, we want to maintain and ideally build. I mean, I have osteoporosis patients who come to me and they're already in full blown osteoporosis, and their doctor says, "Well, you're just going to have to be careful the rest of your life. You don't break a hip." And I call BS on that. I put people on 70-year-old women on testosterone. I put them on estrogen. I teach them how to weight train and do their resistance training and check their bone density again in a year. And oftentimes it says, improvement. And a lot of
yeah,
times their doctor will have said, wow, that's not typical. Well, it's not typical in our traditional medicine. It is typical if we actually get to work. And same with my men. I mean, some of my men are at risk of that too. And trying to fight insurance for bone density for men is near impossible. So you're right that there are some things where like women can get a bone density no problem, but some of my men need that too, and I can't for the life of me get it for them. But luckily, cash pay is not that expensive. But yeah, I
yeah,
think that your body composition changes, so you might still have your muscle, but the myokines and the things that are released from healthy young muscle are a little
yeah,
different than our 50 and over muscle.
yeah. And ladies out there who's listening to this, you did hear her say that you can get on some testosterone. Most women, you mentioned test, they think, "Oh, I don't want to get big. I don't want all that muscle." That's just
Yeah.
not going to happen. So if you can dig into that a little bit more with the ladies, knowing that they can have, because I tell everyone when they come on board with me, I go, look, get your test levels checked, get your estrogen levels checked, and get your thyroids checked. That's my most important things that I tell them to do. So if you want to dig in a little bit more about how the amount of testosterone and stuff like that that they should take.
Yeah, I mean, I think that a lot of times, people think of testosterone men, estrogen women, but the reality is that both sexes create both hormones. Like we have it's a little different of an orchestra and a different percentages, but actually we all need those things. Women need testosterone. Unfortunately, the FDA has made it a controlled substance, which is dumb in my opinion. Makes it really hard for women to get testosterone. Every week, I'm fighting with pharmacists trying to get them to give my patients the testosterone that I ordered. I can get it from a compounding pharmacy very easily, but then my women patients are paying $50 or $60 a month for testosterone when really, if they could get it from the regular pharmacy, it's going to cost them pennies a day. So there's really that's all kind of legal stuff that I think the current FDA commissioner is somewhat on board, but women need testosterone too. But even it's an uphill battle. Pharmacists, most doctors won't prescribe it. I will prescribe it, but I'm fighting the pharmacists who are gatekeeping it. And then I'm trying to convince the women, come on, we just got to try it. But I think there also are places that are not regulated. There are people that are not educated that put pellets in women, do all kinds of crazy stuff and get super physiologic. And that's the problem, right? It's all should be about a balance. We don't really want to go super physiologic. We want to replace what's naturally declining because we don't, I tell people it's like an orchestra. Our hormones are conducting this orchestra. We have all these individual organs that, everyone could play really good on their own, but how can they play well together? And if we just blow you out of the water with testosterone, guess what? We're throwing off your cortisol, we're throwing off your estrogen, we're throwing off your progesterone, we're throwing off your brain hormones. So we don't want to do that. And so there is a way to do it and a way to monitor it. And unfortunately, not a lot of people are trained how to do that.
So
Yes.
what is out there for estrogen blockers for men to keep your test levels from estrogen blockers for men? Is there anything out there for that?
Yes, there are. There are natural herbal things and there are medications. I actually check my patients that I have, my male patients that I have on testosterone. I check how they're metabolizing it, because what you don't want again is for you to give testosterone and have people converting it to estrogen. Obviously,
Hmm.
that's not going to help you. So there
Hmm.
are blockers to do that. There's a whole pathway that I show patients, and I say, okay, I want you to eat more of this. I want you to drink this tea. I want you to use this herb in your cooking. If you are still doing it, then we'll throw, medication at you. But a lot of time, I'm integrative medicine trained too. So I like to use plants as medicine when I can. But yeah, we want to know, we want to make sure men are not converting testosterone to estrogen. We want to make sure that women aren't converting their testosterone to cortisol. So I think there are, you can actually do urinary metabolite tests and assess what these people are doing biochemically with the hormones you're giving them. And I actually require
Right.
that once a year on my patients that are on hormones with me.
Awesome.
Awesome.
I got something for you too, Doc. One, I know you lead by example. I think we had a conversation before. I said, hey, I've had doctors telling me what I need to do, and they're huffing and puffing and basically, almost having heart attacks while they, examining me. Um, how important is it for weight training, resistance training to be involved as you get older? And what is your sports background and your background doing it? And leading by example, what does that do for your patients?
So, strength training has a profound influence on our body's function. Honestly, I think that I just read a study probably about a month ago, and really it was kind of ranking different lifestyle things and how they contribute to longevity. And strength training was number one. So, we have to keep our muscle. And there's many reasons for that. So metabolically, we have to keep our muscle because that actually helps our hormones work better if we actually have muscle and not fat. Fat is pro inflammatory, muscle is anti inflammatory. So we want to have enough muscle for our metabolic hormones to work well. The other thing is, as we get older, obviously, the thing that tends to take people out and put them in nursing homes is falls. So you want to have balance. You want to have be able to step up steps and to hop over something. Like you want to be able to do that. You want to maintain your grip. That's a good marker of your strength. So I think that strength training does so many things. But those are probably the most important. I think that like I said, my mother always did exercise when I was growing up. So I grew up watching her do that. I started probably, after I always would go for a run in medical school, but in medical school things are kind of crazy. I had my first child at 32, started running. I did 5 half marathons between my 32 and 45. I just started running because that was what I could do quickly. And then I also was doing CrossFit. I did a lot of CrossFit. I did a lot of master swimming, some half marathons. After 50, I started to, realize that CrossFit was actually too hard on my body for a lot of reasons. I started getting more injured. I was more prone to injury. Things changed. And so you have to, switch your mindset from balls to the wall to protect. So I always, nowadays, I am kind of a preserve and protect. I'm careful with the load I put on my spine. I make sure I do my mobility. I do swimming because I think that helps. I manage my stress so my cortisol's low so that my muscles aren't inflamed, so that I'm not going to injure my back when I'm lifting. So, I think that we have to think about all those things, but it all evolves over time. And I think what I was thinking about when I was 35, 40 is very different than what I'm thinking about now at 55.
Excellent.
So we have a lady come on, Melissa. Hello, Melissa. She's asking you a question, Doc. She's saying, how do we help get testosterone reclassified so it's more accessible for women? It bothers me. I pay insurance and then I have to pay out of the pocket for compound pharmacy.
So I think there are people that are trying to work on getting testosterone classification change. Obviously, that's a bigger issue. There are people working on that. I think Rachel Rubin is an MD. She's a urologist. She's all over social media. If you Google FDA commissioner and testosterone and like medical panel, I think it was last year, there was about 5 doctors, orthopedic surgeon, urologies, all talking about how much women need testosterone with this FDA commissioner. So I think there are people that are working on that. I agree with you. I don't think it's fair that we should have to pay for compounding testosterone. And I've been battling my local pharmacies and honestly, probably for a couple of years. And I would say just in the last maybe month, I have sent many prescriptions and I've not gotten them back. There is a way actually, um, and I'm happy to, I don't know how I can send that if there's show notes or something, but there is a way to write it. And you have to write that it's off label. So you need to find a doctor that knows how to do that. If they're part of the North American Menopause Society or the ISWISH, which is like a sexual health society, I'm happy to provide those, and then you could try to find someone near you that is able to write the prescription because you have to write it exactly right, or the pharmacist will reject it every time. It's really it's one of the most frustrating things because I feel like as the medical doctor, I'm writing what I want my patient to do, and I don't think the pharmacist should be able to tell me that I can't do that. It's super frustrating for me too.
Yeah, interesting. So when there's a medical issue with your license and everything to approve something, do you have to go above the rim to besides what you're sharing with us now? Is there like another level that you can reach to that you guys can reach to go, hey, look, this needs to be clarified at some point?
No. I mean, I think that the California Pharmacy Board. I'm in California, so I think different states have different rules. I don't Texas, I don't think is bad. Florida is like you could do whatever you want in Florida. I think there's a whole variation. New York is even more strict than California. So I think it's kind of varies state by state. So which is
Got it.
also unfair, right? I mean, this should be federal. We shouldn't have women that are in New York that can't get testosterone, but a woman in Northern California can. Like it
Yeah.
just really it there's definitely obviously more at play than just medicine here.
I got a question. I'm trying, and I'm asking, when mental health and hormones, and somebody that may be having struggling and on medication with mental health, and hormone therapy and stuff, how does that work, or how does that go in? Because I know people have mental health issues and taking medication and they're depressed and they're gaining weight, but they want to work out and stuff. So if they come to you, what would that be about?
So yes, it's all connected, right? It's all part of the orchestra. So the hypothalamic pituitary adrenal axis is kind of what I'm looking at all the way. So I start with the brain. So, what is your serotonin? What is your dopamine? What is your norepinephrine? What is your GABA? Like, why are you not sleeping? Why are you depressed? Why are you having panic attacks? So I, as a biochemist, look at it from a pathway perspective. And so I start by measuring that in the urine. Again, I'm not doing a brain biopsy, so it's not 100%, but oftentimes I would say that's the thing that moves the needle the most that I do that a lot of people don't do. And my interest in that started because I was working with veterans and they had such bad PTSD. So yes, hormones very much affect the brain. Serotonin is very connected to estrogen. Progesterone is very connected to GABA. So when they come to me, I try to assess, is this hormonal? And if it is, I treat it hormonally. I don't treat it with SSRIs and antidepressants. I'm not saying that I don't use those. Sometimes I do, but a lot of times I don't have to. I would say 9.5 times out of 10, I don't have to because I fix the inflammation. So if your brain's not inflamed, your brain hormones are going to work better. If your brain hormones are working better, then that's going to send the signal down to your gonads, so your ovaries and your testes, and all your hormones are going to work better. So I try to get to the root cause of what the problem is rather than just putting you on a medication that's going to block the reuptake of serotonin and just blast you with serotonin, which can be helpful. Those are very important medicines. They can be helpful, but I think they're handed out too much.
Hmm. Huh. Wow. So I'm listening to everything you're saying, and it doesn't seem simple. It seems very difficult in your position to have to fight for what your degree allows you to do. You know what I mean? It's like someone telling
Yeah.
me, "Yeah, I know you have a degree, but you can't tell me what to eat." You know what I mean? It has to go to another level. And so, is there? Now, this is a little deeper than I probably need to talk about, but I'm just curious because I'm curious. Is the fact that is there a board like with your medical board that people are fighting for you, or is it just you as an individual?
So, yes, there are people that are trying to expand this way of medicine. So there are big groups. There's the Institute of Functional Medicine. There's Anti-Aging for Medicine. So I would say that obviously I was trained at Stanford, very conservative, very much evidence based. I thought it was the end all be all when I left there. Once I started practicing, especially in a complicated group like veterans, and then I myself started going through perimenopause and was just getting dismissed. And I was like, wait a minute, I actually know there's a problem. And I was just, getting dismissed. And I started thinking, okay, I don't think I learned everything I need to learn. So then I sought out these bigger organizations who are practicing the medicine that I believed in. I did another fellowship, have taken more board certifications, trying to get to where I have all the tools to help my patients. But unfortunately, after 13 years of medical school, a lot of people don't have the time, the money, the energy to want to go on and do more training, and so they just practice what they learned, and then that's just their job. I'm super passionate about it, and I also am passionate about it because I want my family to be healthy. I come from a family that struggles with a lot of diabetes and obesity, and so I've always wanted to be able to try to fix that, and I, as a biochemist, I knew I could. So there are bigger organizations. I don't necessarily, I think it's really going to be a mindset change, and in medicine it takes years. I mean, the Women's Health Initiative in 2002 was very wrong, the way it was presented in the media, and we are just now coming back from that 25 years later. So it takes a long time, but I hope that someday we get to a point where there's more precision medicine, and where it's not, when we're trying to get to the root cause and trying to focus on food as medicine, hormones should be balanced, inflammation, like those have to be in place before we start piling on medications. I think we'll get there, but it'll probably be another 25, 30 years. There are some medical schools, some newer medical schools, that are really starting to open and bring in this focus of whole body medicine. And so what I'm doing won't seem, it was seen as super out there. I think it still is to some of my traditionally trained colleagues, but I don't shy away from that. I mean, I always just fought for what I thought is right, and I will continue to do that. And obviously, there I do have to stay within the confines of protecting my medical license. But I think much of this stuff should be basic medicine. So I'll just keep doing it. When I opened my own office in 2014, I thought, I'm either going to leave medicine because I don't believe in this anymore. I don't believe in the way that this is going, or I'm going to open my own practice, and we'll see. We'll just see if it goes. And it took off. I mean, I haven't been open to new patients for several years.
Yeah, she's
So
booked.
I
She's booked up to be booked up.
yeah. Yeah. So
Yeah.
patients want it. So I think it's really patient demand. So I encourage my patients, like, write your congressman, write your people, write them and say, I should be able to get testosterone like my husband gets it. Why do I have to pay for it separately? So it's going to take all of us to
Yeah.
change.
Okay, so we're going to drop this power story that you're sharing, which is a lot stronger than stuff that Mike and I talk about. So I want you to reach out to some of the people who listen to us on a Sunday basis. And that is, we talk a lot about how you should always go get your levels checked at some point in time. When would you say be the first age coverage that a guy should go and get his test levels and everything checked?
Well, I mean, I think it depends on the patient. I think it depends on the symptoms. So I definitely have had 20-year-olds come to me, and my initial response is, "Oh, your testosterone's probably fine," but they're complaining of different symptoms that seem kind of similar. So I'll check them, and I have had some of them actually be low. And then I start talking to them. I actually had one probably a month ago. I had a 21-year-old who had all the symptoms of low T, and I thought, oh, it's so strange. And so I started talking to him about his life, and it turns out he wasn't sleeping. he was gaming all night, and so he was sleeping from 3 a.m. to till 11 a.m. was when he was sleeping. So then I had to go back to, okay, listen, at 10 o'clock at night to 2 a.m., that's when you're building your testosterone. You missed that window. So look at your blood level. It's like 200, your total T, and you're 21 years old. That's not good at all, because you're supposed to be building your bone and muscle like to your peak right now. So this is a real problem. So I don't know if there's just one set. I listen to the patient and their symptoms. I would say everyone over 50, I usually check, maybe 45, but it depends. I'll check it sooner if I feel like there's a need to. Sleep apnea is a really big problem that causes low T. So if they have risk for sleep apnea, then I look at that sooner.
Yeah, I have a couple of clients that I train that are either wear the mask or they don't wear the mask, and they talk about how tired they are no matter what. So that I'm sure that low T. I always tell them that your test got to be low, and that you should get it checked.
Yeah. The problem with them is giving them testosterone does not help them. They really have to treat the sleep apnea.
Yeah. So do you say that would you say that the mask and all of that stuff is top notch, or is it second compared to the insert?
I would say the data we have is with the mask, but the mask is a pain in the rear. So it's really hard to get people to be compliant. So I just tell people, whatever you can do to be compliant, and then let's check your testosterone levels. Let's check your levels and see if it's improving. If it is, then we found our answer. If not, then you have to go for the full face, and you have to really give it 3-4 months and try really hard. And most of the time, if they do that and they can get over that hump, because it's a pain and it's not very comfortable, but the patients that do, 6 months later, feel like completely different people. And it's not just their testosterone, like their insulin's down, their inflammation's down, their weight comes down, because their energy's better, their focus is better. So everything changes. I mean, if you think about depriving yourself of oxygen all night when you're supposed to be sleeping, like that's going to have like far reaching ramifications, right?
Sure. Interesting. Well, Mike, you got anything else?
Man,
I think we've heard it all.
and that's what I want people to understand. See, they talk about us talking, the two old black guys talking, but we bought you a doctor, and she gave you a wealth of information. And I hope that you guys now understand some of the stuff that me and Rob talk about is the truth. That you gotta get your levels checked. You not just get your basic stuff done, and make your doctors, when you go for a physical, tell your doctors this is what you want. These are the tests that you need to have, because some doctors are cookie cutters, man. And I'm glad that Dr. Leslie came on, and the passion that you have. You don't see that with a lot of doctors. I've had a couple of doctors with that same passion. They do stuff outside of their box within the realm of not losing their being a doctor stuff. And I've been fortunate, but a lot of people, man, are not satisfied because people are coming in and out 5 minutes and pushing you in, pushing you out. And it's a lot of things that's going on with people. And if they would have just took the time, maybe take some levels, do some of the stuff that you did, the people could function a lot better,
Right.
Yeah, I mean, I think I would just say, I mean, I defend my primary care doctors because it's a hard job, and it's unfortunately medicine has become for profit, and there is so much behind them that's pushing them to do. I mean, I think that's an issue, and I think the other issue is, like I said, I mean, these are things we didn't learn in medical school. So if you didn't have a biochemistry degree going into medical school, like if you did English or something, which is great, we want well-balanced doctors, then you may just not have that information. So I tell patients, you can ask your doctor for these certain things that they know how to deal with, but you're going to find they don't really know how to do some of this other stuff. And then you have to seek that elsewhere. Like a lot of patients just order their own labs now online, and then they put it into Chat GPT, and then they'll bring it to me, or then they'll try to figure it out. So I think there's a lot of roads. What I would say to patients is don't stop. Like if you're not getting the answers and you still feel like hell, like keep going. It may not be through your primary care doctor. but please don't do it through, you know, the tamale lady. Like let's find someone who actually is trained to help you
Wait a minute,
with these problems.
my tamale lady's pretty good, though. No.
We all got our strengths. We all got our strengths.
Yeah. Now we definitely appreciate you having you on there. And I know you're full of patience and everything, but sometimes people may have a question or something, or even questions that we might need to ask or whatever. So if you want to give your information where people can reach you on social media.
Yeah, I mean, I'm on Instagram, Soul Strength Medicine. So I think that's probably the best place. I manage all of that. That's why it's not very fancy, but I do manage that myself. And obviously, I can't give medical advice over social media. But if there's some resource or some information, like I think people in other states need to know like how to find doctors that have similar training to myself. I think those are useful things for your patients to have or for your clients to have.
Awesome.
Excellent.
Awesome.
Okay.
Well, yeah. Well, we'd like to thank you once again for coming on to the show. As always, we try to reach out after a month or so, 2 months, and reach out and see if you can give us some new information in case questions come to us. You and Mike is, buddies now, and so I will share with Mike if I hear something that people want to know, and we can kind of go from there. But we appreciate your time and your knowledge. And Mike, if you don't have anything else.
No, that's it. I just want to say hi to Melissa and thanks for the questions. She wanted to thank the doctor too as well for the wealth of information that she handed out today. And like I said, we'll bring on people. We can get people like this, man. This really kind of breaks a lot of the myths and stuff that people hear out there. And you get some truths and you get somebody that has a passion and somebody with a sports background and that works out as well. So it all correlates. It's not somebody that's passing out information. And I like because of the experience that you have. And we can't thank you enough, Doc. Appreciate you.
Yeah.
Thanks,
so you guys out there, please like and subscribe and leave a comment. Let us know what you think, and we'll get the doctor back on here. All right, everybody. Peace out there in TV land. Boom.
Bye.
Later.
Bye.
Peace.